Friends, a very common skin infection which we find is called as Herpes Zoster. In Marathi, it is called as Nagin. This infection is seen as in this we see multiple vesicles or the blisters coming in a girdle-like form, either on the face or on the chest or anywhere else on the limbs also. It is essentially on one side of the body. It is very, very painful, associated with burning and great discomfort. So much so that the patient is not able to sleep at night. You must have definitely seen this happening in any of your relatives. I'm sure about it. But then, what is this? Herpes zoster or Nagin is a disease which is second attack of chickenpox. That means somebody gets chickenpox in the childhood, the viruses remain dormant in the body, especially in the nerve tissue, and at a later date when the anti-chickenpox immunity goes below a certain threshold, then these viruses dare to come out of their hiding site, and then along the nerves they come outside. At the end, when the nerve ends, they come on the skin surface causing blisters. As they are traversing through the nerve, they give a lot of pain, burning and such symptoms. There are two important misconceptions about this disease which are common in the society. One of them is that the modern medicine does not have a medicine for this, which is absolutely false. In modern medicine, we have got excellent antiviral drugs which can be used for the treatment. The second misconception is that the disease would come from both sides of the body, and when the ends meet, it is fatal, which is absolutely wrong. This disease most of the times will be found on one side of the body, and the disease is only restricted to the skin, so there is no question of fatality. So please do not get carried away with these misconceptions which are being spread by some of the elders. So this herpes zoster can come on the face, which can cause very severe discomfort, or on the chest or on the limbs, which I told you. Over a period of next 7 to 10 days, the blisters slowly resolve and there is a crusting, and later on some painful scar may remain in that area. Timely diagnosis done by the doctor can save the patient from excessive pain and discomfort because the treatment can be started early. Elderly, if they get this disease, they are likely to have more prolonged pain even if the blisters and the ulcers heal completely. So, this herpes zoster is that way a very painful and discomforting disease, but can be self-healing, but especially with treatment, it can be completely treated. The most useful drugs for this disease are antiviral drugs. Acyclovir, famciclovir and valacyclovir are the drugs which are used for this disease. In appropriate dosage for around 7 to 10 days, they can reduce the viral shedding, so infectivity of the patient, as well as give a good relief from the symptoms. If given properly, they can also reduce the postherpetic neuralgia, the pain which comes up after the zoster attack is over. Herpes zoster is a treatable disease. Though it is discomforting and painful, if diagnosed properly at an early date, you can definitely avoid most of the symptoms in a nice manner. You have to take more care of people who are elderly because they are likely to have very troubling discomfort. If you have a very, very small child in your residence, then it is better to keep that child away. I mean, a child less than 1 year of age. It is better to keep the patient away from the child because there is a possibility that the child will get chickenpox from this patient. Otherwise, the disease is not much infectious for the adults. Understand herpes zoster, treatable disease, but unnecessarily misbeliefs are there in the society. Understand the disease well, and if somebody in your family is suffering from this disease, do contact the local dermatologist and never self-medicate. Thank you.
For more such videos, visit or log into DermaVidya.com.